My name is Caitlin Oakley, and I will be presenting my paper on ankylosing spondylitis, and this is going to be an overview of clinical features. What is ankylosing spondylitis? Ankylosing spondylitis is a chronic inflammatory form of arthritis. It causes severe pain in the axial skeleton and stiffness in the spine. It is a subtype of a group of diseases called spondyloarthritis. In this presentation, I will review the pathogenesis, genetic factors, risk factors, diagnostic methods, treatment and management options, and prognosis and mortality rate for people with ankylosing spondylitis. Pathogenesis of ankylosing spondylitis is most often related to a gene called the HLA-B27 gene. 95% of people with AS have the HLA-B27 gene, but only 2 to 10% of people who have this gene actually end up contracting the disease in their lifetime. This is because the HLA-B27 gene has many subtypes, and you have to have a specific subtype to be more susceptible to contracting ankylosing spondylitis. Even though 95% of people with AS have the HLA-B27 gene, there are other people who are diagnosed with ankylosing spondylitis and who do not carry the gene. There's not a lot of research as to the pathogenesis for people with ankylosing spondylitis who do not have the HLA-B27 gene, and more research should be completed on this subject. The genetic and risk factors of ankylosing spondylitis. The predominant risk factor for ankylosing spondylitis is the protein HLA-B27. This has been the predominant risk factor since it was first discovered, and most people who have ankylosing spondylitis actually do have the HLA-B27 gene. Unfortunately, this gene can be passed down to family members and gives them a higher chance of contracting the disease in their lifetime. Gender is also plays a role in the risk factors or genetic factors of contracting ankylosing spondylitis. Men are more likely to contract the disease in their lifetime than women are. Also, white people are more likely to contract the disease, and non-white people who have the disease are more likely to not have the HLA-B27 gene. Studies have shown that gut inflammation is often associated with ankylosing spondylitis, which means that people who have gut inflammation might be more likely to contract ankylosing spondylitis. There are also studies that relate smoking with ankylosing spondylitis. Diagnostic methods of ankylosing spondylitis. Unfortunately, diagnosis of ankylosing spondylitis is usually a slow process. One study showed that the mean of diagnosis in patients was usually about 8.5 years. This is because even though lots of people have back pain, ankylosing spondylitis is relatively rare, and many physicians don't know the signs and clinical features of ankylosing spondylitis to look for in patients. These patients that are usually diagnosed after 8 years complained of symptoms within the first year of exhibiting them. But when ankylosing spondylitis is diagnosed, it's usually by using imaging scans such as X-rays or MRIs. These X-rays and MRIs are able to show abnormalities on the spine that indicate ankylosing spondylitis. Blood tests are also used, and these are used to test for the gene HLA-B27 because if a patient is exhibiting signs of ankylosing spondylitis and they do have the gene HLA-B27, they most likely have ankylosing spondylitis, and this is a pretty good way to confirm diagnosis. Even if neither of these methods work, if a patient is exhibiting all the signs and symptoms of ankylosing spondylitis, this could be a way to diagnose them with ankylosing spondylitis. Symptoms of ankylosing spondylitis. The most common symptoms of ankylosing spondylitis are lower back pain and stiffness. Most patients who have ankylosing spondylitis complain of these symptoms. But other symptoms of ankylosing spondylitis could be hip pain, joint pain, neck pain, and more rare symptoms would include difficulty breathing, fatigue, loss of appetite, abdominal pain, diarrhea, skin rashes, and problems with vision changing. Treatment and management options for ankylosing spondylitis. Unfortunately, ankylosing spondylitis cannot be cured. However, it can be treated and managed. The most common treatment for patients with ankylosing spondylitis are non-steroidal anti-inflammatory agents. These are the most tested and most effective medicine that are used by physicians to treat people with ankylosing spondylitis. There are a few other options like ustekinumab, disease-modifying anti-rheumatic drugs, methotrexate, and then a few holistic methods that are recommended by some physicians, such as exercise and physical therapy, in which some studies show to improve pain and mobility in patients. The prognosis for people with ankylosing spondylitis. Fortunately, most studies show that people that have ankylosing spondylitis are able to live normal lives. Some people, however, are severely affected. The main cause of death in people with ankylosing spondylitis is circulatory disease of the heart. There's a higher mortality rate in men than in women, and early diagnosis increases survival rate. The people that are most severely affected by ankylosing spondylitis are the people that are not diagnosed early, and usually when they are diagnosed, they already have severe pain and symptoms. And at that point, they're still able to be treated, but treatment and management options are not as effective. Even though this is the case for some people, most studies are optimistic about the prognosis of people with ankylosing spondylitis. In this presentation, I discussed the clinical features of ankylosing spondylitis, such as the pathogenesis, which is usually related to the HLA-B27 gene, genetic factors, which is also usually related to the HLA-B27 gene, risk factors, which include smoking and gut inflammation, diagnostic methods, which are most commonly used. Ones are imaging scans such as X-rays and MRIs, and the blood test that tests for HLA-B27. I discussed treatment and management options, in which NSAIDs are the most common use, and we discussed prognosis and mortality rate, in which some people are severely affected for the rest of their lives, but most people are able to go on to live normal lives. The takeaways from this presentation and the main points are that ankylosing spondylitis is a form of arthritis that causes severe pain and the stiffness in the spine. HLA-B27 is the most prominent risk factor and diagnostic method for people who have ankylosing spondylitis, and if you have the gene HLA-B27, you do have a 2 to 10% chance of contracting the disease. and 95% of people who have ankylosing spondylitis do have the gene HLA-B27. The main treatment methods are NSAIDs, and most studies are optimistic about the prognosis of people who have ankylosing spondylitis.